get started here. How's everybody doing? Thank you so much for coming to this year's first Timmy Talk. Thanks for making time. Hopefully everybody got some food. If you still need to get some food, there's some more sandwiches up there. So my name is Zach Wright. I'm the president of this chapter's Timmy Global Health, or this school's chapter of Timmy Global Health. I just wanted to introduce a couple of things and then we're going to get started. Again, thank you everybody for coming. We will be sending out some updates about monthly meetings that will take place. So throughout the semester, there's going to be opportunities to participate with our chapter. I'm going to leave what exactly Timmy Global Health is for those of you who want more information on that to Alyssa, who will tell you all about it. But we're going to have events where you can participate in community service, local community service, do fundraising to support the work that Timmy Global Health does both locally and globally. And then there's also going to be some opportunities to do some international travel through medical mission type work. So we don't have all of those things on the calendar yet for this year, but look for emails and updates regarding those things. If you're not on a listserv, we had an event before school started where a lot of you signed up to receive emails from us. If you did not put your email down on that list, come talk to me afterwards or send me an email. My email is jwright507, or just look up Zach Wright, or just come find me on campus. So I think that one thing that I do want to mention is that we'll have a meeting, first monthly meeting, either late August or early September. The medical service trip that we will take, our chapter will participate in, will be in May, end of May of 2015 to the Dominican Republic. Again, more information to come on that. We haven't really got the details of how that process is going to work, who's going to be able to go, all that down, but that's a priority for us, and we're hoping to have that group selected by the end of November, early December, so that you have time to plan for all of that. I do also want to mention that Timmy Global Health is having a student conference in the weekend of September 6th. There's a panel discussion that will take place on global health Saturday evening that it would be great if we could coordinate a group from Marian University to go and watch this panel discussion. I believe it's at IUPUI, right? Hein Hall, but we can talk about all that soon. The next thing that I would like to do is kind of introduce a couple of the trips. So the idea for today is we're going to have a discussion led by Alyssa, groups that traveled this summer from the College of Osteopathic Medicine. And so there was a group that went to the Dominican Republic through Timmy Global Health. There's a group that went to Africa, several countries in Africa. And then there's a group that went to Honduras. And so I will just introduce the trip that went to the Dominican Republic. We had 5 students that Timmy Global Health works by having college chapters, and there's about 40 plus chapters across the country at different universities and colleges. And we actually tagged along with a team from Washington University in St. Louis and had a clinic of about 5 days, or a trip that lasted about 5 days, and saw probably 600 or 700 patients within that week. And we visited a territory on the northwest border of the Dominican Republic. So we'll talk more about what our trip was like throughout this presentation, but that's just a brief introduction. I'm going to let Allison introduce what her experience was and her trip to Africa.
Hi everyone, I'm Allison. I haven't met you. Hello. This is the 3 of us are 3 of the 5 students who went to East Africa this summer through the group we went with was the Apostles of Jesus, and they're a missionary organization based out of Kenya, but they do more than just missionary work. They have schools, and they have clinics, and they have AIDS ministries and orphanages and kind of everything under the sun that they help take care of in most of East Africa. They also have mission sites here, which is how I got connected with them. And our trip was 3 weeks long. We went to Kenya first for the first week, which is where we spent time at an AIDS ministry. And we did 2 medical camps in the first week we were there. We saw about 900 patients across 2 days. And then worked with, there was a school kids there, so we played with the kids occasionally and just had a good time. We also saw baby elephants. It was adorable. The second week we were in Tanzania, and we spent some time going to some of the Apostles of Jesus mission sites. We went on safari, had some fun since we were in Africa. We had a lot to see. The third week we went to rural Uganda. We were at a place called Lima Farm, which is another mission site where they have a local clinic, and we serve the rural community there. We participated in a vaccine clinic the first day, and we also then helped kind of see patients in the clinic that week. We saw maybe between 5 and 10 patients each day. It was a pretty incredible experience. You guys agree? Give it a minute. Yeah. It was awesome though, so yeah.
Thank you. Is anyone here from the group that went to Honduras? I don't see Brian. I don't know a ton about that trip, but if you're interested in Honduras and talking to Brian Koltnecker is a second-year medical student, and he's around all the time, so we can connect you if you want to speak with him about that trip. The last thing I want to do, like I said, watch your emails for updates. We're really happy that you came and are here today. This group is still forming, so there's a lot of opportunity for you guys to kind of shape it and be involved. So we're happy to have you. I'm going to let Christina Berner, who is in charge of planning this speaker series throughout the semester, talk a little bit more about what that is and who our speaker is today. So thanks a lot, guys.
Hey guys, I'm Christina. I'm a second-year medical student here. Really quick, so I can get Alyssa started. We made a Facebook page, so I'm sure I've been going through everybody who's labeled their school as Marian University Osteopathic Medicine. I'm requesting everybody, so I will find you. And if I don't find you, come find us. It's just Timmy Global Health, and at the top of it says Marian University. So that's another way for you guys to stay up to date with all the stuff we're doing. One big thing that we started doing last year, which is the speaker series, we kind of focus on local issues for the first semester and then move to global issues the second semester as we're getting ready for it to take our trip to the Dominican Republic and everything like that. So far we're starting, like Zach said today, with a more local, more Timmy, just kind of summary of what we did this summer. And then next month our speaker is going to be Dr. Lemons, and he actually teaches at the Ivy School of Medicine in pediatrics, and he's also a local physician, and he also works in Africa with some different kind of medical brigades and stuff like that. And then in October we're going to have Dr. Evan, or Mr. Michael Evans, the one who donated so much money to have this building and everything for the medical school. So he's going to be awesome to have. So just look for emails, look for updates on the Facebook page and for meetings and stuff like that. But today we're having Alyssa Rossodivita here from Timmy Global Health's headquarters, and she's the program director there, and she's also going to talk to us today about what Timmy is, what we do, and just kind of have some fun interactive stuff. So if you have any questions, shoot us an email, find us on Facebook, or just grab one of us at the end of this. And please join me in welcoming Alyssa.
Okay, hi. Is this working? Is this too loud? Not loud enough? It's good, okay. Hi, my name is Alyssa. I'm so happy to be here with you all today. I really appreciate you having me and hearing who you're having in the next couple months. I can't believe you came to listen to me. So I won't do too much of the talking. I'll let you guys do most of it. But thanks again for having me here. I know most of you are first and second year medical students, very busy. And so I'm just really pleased that you took time to come not only learn about what opportunities are available, but start to think really critically about what opportunities you want to take advantage of. That's what I'm hoping you'll get out of today. Okay. So first I do want to talk about Timmy Global Health. That's the organization that I work for. It's the organization that Zach and Nina and their executive boards group is a chapter of. We are a national organization. We're based here in Indy. How many have heard of Timmy Global Health before? Woohoo! All right, nice. We're on 22nd Street in Pennsylvania. But our reach is very much global. In 1997, we were founded by Dr. Chuck Dietzen, who is a pediatric rehabilitation specialist here at Riley Children's Hospital. And he did a lot of good works throughout the world, kind of here and there, and then kind of in 1997 realized I need to put a face and a name to this and give it some more detail. And so he called it the Timmy Foundation after his late brother who had passed. And at that point, we started to say, let's form some really solid partnerships in specific places and provide them continuous care. And so that's when we brought in a new executive director. We started to go to Ecuador, Guatemala, and the Dominican Republic, providing primary care clinics every 2 to 3 months. And to this day, that is our main model. We provide primary care in the form of mobile clinics in periodic, every quarter, essentially, to our patients in each of our partner sites. But a few years ago, maybe like 5, we said, wait, there's more to it than just providing primary care in a mobile medical unit. If we go and see a patient who has the flu, we can give them medications, but if we go and see a patient who needs an extra exam or procedure, what are we doing for them? And so we started our referral program. You might have heard of this. This exists in many forms throughout the world, but our referral program is where we send patients to local clinics and hospitals to receive extra care, procedures, surgeries, things that they really need that we just can't do in a mobile setting. And we actually then pay for part of or all of those services. So that became a huge part of our program, and now we have a referral piece in each of our sites abroad. And then kind of most recently, we said, okay, yes, so there's continuity of care. That's super important for patients. You know that here in the US if you're beginning to practice and learn. Also being able to access clinics and hospitals, that's really important too, but there's also that piece of social determinants of health or your environment. So for example, not having safe water or not having access to vaccinations, things like that are also going to determine your health outcomes. And so we said, we need to start impacting those as well. So slowly but surely, we're starting to create things like a malnutrition project in Guatemala, since malnutrition is just rampant there. A Safe Water Solutions project, which Zach has actually worked on in the Amazon basin of Ecuador. So we're starting to implement those more public health prevention measures in addition to that primary care provision. So that's kind of the overview of where we've come from and what we're doing now. And then we utilize the fuel and fire of student chapters to do that work. So you guys have a student chapter here. You're one of about 40 to 45 chapters that we have throughout the country. And the reason that we can continue to do this work is because of people like you joining our chapters. Our chapters do a bunch of things. They fundraise, advocate, and serve for our patients. So not only do they go on medical service trips, much like the group here got to do, but they also fundraise throughout the year, which it sounds like you're going to be doing, because that money goes directly towards our patients getting them services. They also advocate on behalf of patients, which is kind of what we're doing today. We're going to do an activity where we start to think critically about what type of service do you want to be part of, because not all services are good, especially in the international aid and relief sector. So that's what we're going to be talking about today, but our chapters fuel the work we do by doing those 3 things: fundraising, advocacy, and service. And again, I applaud you for being here and even considering joining that movement in whatever way you should choose to do that. So I hope that gives you a better understanding of Timmy, what we do, and how we do it. And I'm our U.S. Programs Manager. I manage all of our college chapters, medical professionals, and a lot of the U.S. side relationships. So why does that make me qualified to do a reflection with you all today? Well, it may not, you can kind of choose, but I come from a background of, I've led our domestic service trip program in college, and so we did a lot of reflecting. I also was a teacher for 2 years. I taught 7th grade. I won't treat you like 7th graders though. And then I now serve in the role of kind of making sure our students are getting really quality educational experiences out of what they're doing, while also contributing to the health of our patients and not putting that second. So those are my qualifications, judge them as you will, but I'd like to lead you through kind of a series of reflections today, and they're all kind of in this same vein. And so I'm gonna actually, sorry to put you on the spot a second, Zach, but Zach said something in the spring at a panel that really stuck with me, and it's this idea that if you're going to volunteer, choose wisely who you volunteer with. Choose wisely the experience you want, but also the experience that you are creating for patients or for whomever you're serving. Because there are good and bad and ugly service experiences, and you want to make sure you go in with your eyes open. So I think that in that vein, everyone's probably here for the right reason, wanting to do something really great. Now I encourage you to think more critically about what you choose to do. Okay, so reflection. It's one of my favorite things to do. Part of it is about the past tense, I promise I'll stop talking in just a minute. Part of it is about the past tense. It's about thinking about what did you do, processing it, analyzing it. But part of it, and I would say the more important part, is about future tense. And it's about thinking, okay, now that I know this, what am I going to do about it? Okay? So that's what I'm going to charge you with today, okay? Really thinking about making kind of good, cogent decisions moving forward in your volunteer experiences. And I'm just going to show you really quick what kind of guides me sometimes in this, and that's the active citizen continuum. It's kind of silly, but it's also really good framework for thinking about this. So everyone kind of starts in that member category. You're not really concerned with the community you live in, but through volunteer work and through reflection, more specifically, you kind of achieve this active citizen position, where not only are you doing volunteer work, but you're recycling that back in, and it's an iterative process where you're then rethinking, okay, how do I want to do this differently? How do I want to live my life differently? And you come to this position where the community becomes a priority in your values and life choices. So that's what I hope for you all as you become doctors out in the field, that you continually make the community a priority in your decisions and actions. Okay? All right, so the first thing we're going to do today, do you guys have a pencil and like a scrap paper or nothing like that? Anyone have nothing like that? You can just think in your head if you don't have that. But I'm just going to start us off with a question, and like you just jot down some notes or think through it if you like. You don't need to say anything yet. And the question is, you're all here obviously because you're interested in doing volunteer work. Why are you called to do that work? What are your motivations? I'm just going to let you think on that, right? Think, why are you called to do this work? What are your main motivations? It's me. Just going to give you a minute. The question is, why are you being called to do this? Why are you here today? What motivations are driving you to do volunteer work or to do short-term and mission work? And maybe now a couple people can just shout out what they're thinking. What are some of your motivations? Kind of the short version. What are some of those motivations? Feeling good? Feeling good about yourself? Yes? What other ones?
Give back to the community that's blessed us with the opportunity to be doctors.
Oh, very good. The patient community. Yes, okay, wonderful motivation. Other motivations?
Religious reasons.
Yes, absolutely. Many people are motivated by religion. Wonderful. Well, there are many other motivations. Injustice? Does anyone feel like there is injustice in the world that they want to correct? Does that resonate with anyone? Or feeling like you can make a difference? Yeah.
I'm from India, so basically the world's are both India, so I understand, I've seen different facets of what's going on. As you said, injustice, corruption, the need for basic options. So that's the motivation for why.
Yes. So I would even say exposure. You've been exposed to what there can be and what there can't be sometimes. And that drives people to want to continue to work forward in this. Yes. Thank you. Anything else you want to share right now? Pretty soon you're all going to be talking. Okay. Any other thoughts on motivation? Yep. Change in perspective, updating your perspective. Can everyone hear when people are talking? Sorry. Okay. Basically, we've said a couple different things, but adjusting your perspective from the I'm focused on myself and my education all day to I'm focused on others, I think is excellent. And then we had a comment up here about being from India and seeing the types of injustices and inequalities that exist. And I'm supposed to use the microphone. I remember now. Oh, okay. You can use your microphones also. or shout. Okay, thank you everyone for sharing. I'm going to move us on. So this activity can be for everyone. You didn't have to have traveled this summer. It has to be anyone who has an opinion on this work. So pretty much all of you, I assume. So we're going to use these 4 opinion things, and I'm going to tell you a couple of thoughts, okay? A couple of statements. I'm sure, how many have done this before? Okay, only a couple. All right, okay. So I'm going to give you a couple of statements. So I'm going to ask you to choose your opinion on them. So chocolate ice cream is the best for me. I go here because I strongly disagree with that. I'm going to have each of you kind of make your choice, and we're going to stop and kind of evaluate where we are as a group. Make sense? So I'm going to have everyone come down, and then I'll read the first statement. So if everyone can just come down here, doesn't matter where you line up at first, and then I will read the first statement. Okay, we'll switch. I think there are many of you, but this is going to be okay. Thanks for playing. So you guys, I'm going to replace the word short-term. I'm going to use the word short-term medical missions here because I assume that's where most of you are headed in terms of your volunteer work. But if you're not interested in doing short-term medical missions, just replace that thought with anything you are interested in. Long-term volunteer work, etc., etc. Okay? So, get ready to move to your opinion. I'll give you about like 15 or 20 seconds to move there. The first statement is, we have an obligation to do short-term medical service work. Okay? We have an obligation to do short-term medical service work. Please move towards your opinion. I'll give you about 10, 9, 8, 7, 6, 5, 4. This is going to be a little more tough. Okay, okay. 3, oh boy. So maybe you can form like lines in front of me. I think I could. So actually, we're fairly even in the middle here, and then I think you guys would just strongly agree. Okay, sorry. We'll just work with it, but if you need to spread out up front a little bit, you can. But I can kind of see we've got maybe a little over a third, a little over a third, and then less than a third here, I would say. And strongly agree. Okay, raise your hand if you're with strongly disagree. Anyone? Okay, disagree? Okay, can I have one of you kind of share with me? Well, first of all, who's with agree? I think that might be our largest group. Okay, and strongly agree. Okay, so can someone share with me? We have a good showing in the disagree. Why don't we have an obligation? Does anyone want to share? Why don't we have an obligation? Okay. Yes, no, go ahead.
Well,
I think it's on.
it's okay. I was thinking that
And make sure you're listening over there and strongly agree, because they have the opposite opinion of you.
wanting to help other people as a doctor is not the same thing as taking a trip somewhere. And some people are called to be in the community that they are already in and that they've grown up in, or go back to their hometown and really foster those relationships there, and in so doing, be the best doctor they can for those people. And I think everybody is called to different communities, and if we were all called to the same community, then people would get all taken care of. So
Thank you so much. Okay, so did everyone hear that? Basically, if you are from, a community that needs help, or you want to live in a certain community that's not abroad, that doesn't require, you want to live there and work there all the time, you shouldn't necessarily have to feel obligated to do short-term work. Okay, thanks so much for sharing that. Let's go over to the opposite end of the spectrum, strongly agree. I think you guys are convening on your opinion. Who would like to share what you're thinking here? Why do you really think that everyone has an obligation to do this work?
I don't know that I would say everyone, but I think I say strongly agree because I think if you have the capability, like if you are able, if you are in a position in your life where you can help, then you should help. So my personal opinion is me, I know that I am like blessed with talents and like a good house and yada yada yada, and eventually a good job, fingers crossed. So like, so I think like, it is my obligation to serve others.
Thank you. but you're not so, you're kind of lukewarm on agree. Anyone want to share? Is it similar to what the strongly agree kind of said? Yeah, thanks.
So while I agree that there's certain people that stand in community collectively as a medical body, we're supposed to fight injustice and disease wherever that may be, and there's a large disparity of that in foreign countries. So as a collective unit of people becoming doctors, I think we need to go out and expand into those areas. But there are certain people that may not have to do that, so that's kind of what I was here.
Okay, great. Well, I think this is really interesting because I think we're actually saying a lot of similar things. So let's keep going. This is wonderful. Thank you all for sharing so much. Okay, your next statement. Short-term medical missions are more about students learning than they are about patients. Short-term medical missions are more about students or volunteers learning than they are about patients. 10, 9, 8, 4, 3, 2, 1. Okay, oh, a little more of an even distribution, but also on the other end of things. Okay, great. So raise your hand if you're strongly agree. I cannot wait to hear your opinion. I think this is such a great, great question. Okay, agree? Okay, disagree? Okay, and strongly disagree. A little bit of a bigger majority. Okay, great. Can I ask you, how many of you agreed were over here for the last statement? How many of you over here were over here for the last, wait, let me do that again. How many of you switched sides is my question. Okay, a lot of you. Okay, great. Okay, so the question was, or the statement was, they're more about students than about patients that we're serving, okay? Why do you say that?
Would feel strongly about it.
Okay.
I think, like, to summarize what we were both saying, like, I feel like it's definitely more student-centered because when you go somewhere for a week, you're not going to pick up on, like, the traditions of that community, and I feel like they are teaching you more than you are teaching them, and you're just kind of like an accessory to that experience. We're not really qualified.
Yeah, especially as we're students there to learn more, and then like once you're actually a doctor, then you would go back for a longer period of time and then teach the students more about what you do there.
So it could be more effective if you go as a licensed practitioner versus going as a student.
Yeah, not saying that. Yeah, not saying that like you shouldn't go at all. I think it's good to get your feet wet, but grand aspirations of helping people for a week, like at this stage
Doesn't
of our
jive
lives.
with you.
Yeah.
Very, very fair. Wonderful. Thank you guys so much. This is great. You guys have great ones. I'm going to go to the opposite end of the spectrum. Who do we have over here? Who wants to share about being strongly in the strongly disagree position? Okay.
All right, I think that if you're going to go to a mission trip or a medical mission, you should be more prepared before you go, mentally and physically. So if you're going to find out how to do IVs when you get there, you're not prepared, so you should be learning how to do stuff when you get there. With that being said, you're always going to be learning stuff when you get there from all cultures. But you should, think about it really hard before you actually make a decision to go on a mission.
So this end really thinks that it's still, so if the statement was it's more about students learning, you think no, it's still about the patients. It's still at its heart about the patients. Zach, do you want to comment about that based on Timmy? James.
Yeah, I think it's kind of what's possible as far as where the focus can be depends on what kind of trip you go on. And if you're there and you're watching medical professionals treat patients, then I think it's going to be a very shaping experience as a student, but it's not the focus of the trip. The focus of the trip is treating people that are in need, that don't have access to healthcare, and treating them with a high standard of care, high quality of care, not just the practice on them. Because I think this is an extreme statement, but kind of what that indicates if you're having that mindset as far as, well, this is going to be a good opportunity for me to benefit from this experience is, these people are poor, and practice on them. And that would not be acceptable in the United States. That would not be acceptable in a place where, and I know that that's not what anybody is saying here. I'm just saying that that's an extreme version of what we're talking about. So.
Good, thank you. Anyone want to share in the middle here what they're thinking? Yes, please.
So I went to Nicaragua for 3 weeks in January, this past January, and it was an amazing experience. And I went there thinking that it was going to be all about the patients and all about giving back to them, and it was amazing. We saw like 2,000 patients and did a lot of care, but at the end of the day, there was so much we couldn't do. There were so many people we didn't help, and in that sense, the doctors were more about helping us learn. And at the end of the day, we helped a lot of people, but I felt like I got a lot from them. Like it changed my perspective and it changed the way I look at life. And so we gave a lot back to the patients, but they also really, at the end of the day, like we're the ones that were changed. So.
For sharing, absolutely. I think what this shows is, again, bringing us back to the very first point I made, that Zach really made. Choose wisely what you're doing and make sure that it jives with your own personal theories, your own personal needs, but then also that you're going in eyes wide open and figuring out, is this really the effect I want to have? Okay, we're going to do like 1 or 2 more of these. Thanks for hanging in there. It's fun, right? Yeah. Okay. All right. This one I like. Short-term medical missions are necessary for developing countries to get out of poverty. Short-term medical missions are necessary for developing countries to get out of poverty. Oh, maybe this is an easy one. Okay. I'll give you a few seconds, and I might change the question. Okay. Oh, good. Thanks. Nice meeting you. Okay, that was too easy. So we all think that they're not, what are you guys? Okay. So you all kind of think they're not necessary. Well, someone just shared the thought on why aren't they necessary? Someone we haven't heard from. Who have we not heard from? Why? Why are they not necessary? Thank you.
I think in order for, like, we're talking about changing like the entire system to be something that's a lot more sustainable than just short-term trips. So they can be beneficial in helping reduce things, but it's not something that's going to make those sustainable big changes.
I have to go to another meeting.
Anyone agree or disagree with that? That wants to share? Sure. What's that? I saw her hand, sorry.
I agree, and like just to piggyback on it, on top of it, it's like beyond medicine, it's like social, it's social issues as well, and learning that community, like the way they work and some of that influence has of like a long-term type deal.
Wonderful. Yeah. How many agree it's more than just healthcare? Okay, yeah. I think anyone disagree it's more than just healthcare? Yeah, I think it is definitely more about healthcare. Okay, I'm going to just tweak it a tiny bit. I'm going to have you move again. This will be the last one. So, short-term medical missions are important for developing countries to get out of poverty. Does that change anyone's opinion? Instead of necessary, short-term medical missions are important for developing countries to get out of poverty. Does that change anyone? Don't just move for on my account, but if it does, please move. Okay. So this isn't even my way. So what we're seeing is that it's not that they're required, maybe, but they are important. They are a piece of this puzzle. But we still have people who disagree with that, right? We still have people who say, no, it's not even important. You want to share your thoughts on why it's not even important? Thank you.
I lived in college, I lived in Micronesia for a couple months doing public health. And what the problem was there, it wasn't that there weren't medical missions there, it was that there was no infrastructure there. So short-term medical missions make the see, but they're not training doctors, they're not creating an infrastructure that's sustainable. So yes, it may help, but it doesn't fix the problem.
Okay. who switched? Why'd you switch? Who switched over here? Why'd you switch?
I don't know, like little steps, small things. I was talking like Timmy, or the guy on the company, it's not like he started small and then now he's a global organization, so just little things. You know, if you can influence one person in the country too, it's
Love the varying perspectives. Okay, I appreciate your time in doing this because I think what I hope it shows you is that we have different opinions, yes, but I also think that many of you are saying qualified statements, right? Like, it's not good unless. And so it's good to start, and some people are saying, well, it's good if, right? And so in essence, I think a lot of us are saying the same things, but it's that how you approach it and what things you say. It's only good if. It's only good if, okay? All right, I have one more fun activity for you to do while you're up here. So okay, I'm not sure if this is going to be very possible, but if you can line up in some sort of a line against that wall. Sorry. Yeah. Or like a double line, well, it would be okay, this will work, good job. Okay, thanks for being super understanding. You can do side step, okay. Okay, thanks everyone for your patience. Okay, so what I'm gonna have you do is draw on any volunteer experience that you've had thus far. Any volunteer experience you've had. Medical would be best in this context, but any volunteer experience you've had will work, okay? And you're gonna either take, okay, so I'm gonna read 7 priorities of good interventions. And this was written in a document. I'll share my resources with Zach, who can share it with you later. But this was written up in an article, and it said, from our experience, these 7 things are priorities in doing good service work. So before I read them, okay, I'm gonna ask that you think about the service work that you're contemplating and take a step forward if you think it was done well. I'm not saying perfect, I'm saying take a step forward if you think the volunteer work you participated in was done well. One step forward, if you don't mind. If you think the volunteer work you did was done well. Ooh, almost everyone took a step forward. Okay, almost everyone, right? Did anyone not take a step forward? You guys? Half step. Okay, great. Okay, take a step back. Excellent. Okay. I'm going to read these 7 priorities, and I want you to take one step forward if you think it describes the volunteer work that you participated in. Okay? If you don't think it describes the volunteer work you participated in, stay where you are. You don't have to back up, just stay where you are. Okay? So at the end, you can be a maximum of 7 steps forward, you can be a minimum of 0. Okay? All right. Thinking about that volunteer experience, for you guys over there, just okay. Priority number 1, a mission or common and specific sense of purpose. So if you think your organization that you volunteered with had a mission or common and specific sense of purpose, take a step forward, please. Okay. Number 2, a relationship with a community and its infrastructure. Priority number 2 is a relationship with a community and its infrastructure. So local partnerships. Okay. Yeah, it's okay. This is good. This is good. We'll ask people who's farthest along. Number 3, education for ourselves, like the volunteers, and the community you're serving. So priority number 3, education for yourselves, like volunteers, and the community you're serving. Number 4, a commitment to doing work the community needs and wants. A commitment to doing work that the community needs and wants. Take a step forward if you think your organization did that. Okay. Number 5. Appropriate supervision of all junior team members, as in the U.S. Appropriate supervision of all team members. So like if you're medical, appropriate medical supervision. If you were doing something else like playing with kids, appropriate, supervision over children. Number 6, building capacity for ongoing interventions. So you're probably starting to hear some of the things you were wanting, right? Building capacity for ongoing interventions is priority number 6. So if you think your organization does that, you take a step forward. And final priority number 7. If you think your organization does this, take one final step forward. Evaluation, a mechanism to determine whether goals are being reached. Evaluation, a mechanism to determine whether goals are being reached. Okay. All right, so it's a bit hard to tell, obviously, based on my terrible spatial awareness, but if people who took all 7 steps forward could raise their hands, please. Did anyone take all 7 steps forward? Hi. Raise your hand high. Okay, just a couple. Excellent. How about if you took 6 steps forward? Where are you? 6 steps forward, hands high. Good. We've got a percentage. How about 5? More. How about 4? High. Sorry. Raise your hand. How about 3? 2? 1. Anyone 1? Anyone 0? Good. Okay, so I would say we have a bell curve, right? The majority of people, I'm talking out of my area here, but the majority of people are in the middle in some way or another. They got maybe 4 to 6 of these priorities from their volunteer experience. Who had the 7 again? Can you speak to kind of what organization you volunteered with and what made you, I think Christina did have them.
Yeah, I wasn't.
Okay.
Okay, so I went, actually haven't traveled with Timmy yet, so I'm pumped about that. But when I was in undergraduate at college, I went with Global Brigades through Indiana University, and it was a great experience. We did a lot of health work there, and we constructed a lot of latrines and eco stoves and built cement floors, and we did a lot of education with kids. And so they educated us, we educated them, we built things that they could use, we were supervised. They also had a system of sustainability, so after we left, after working with them, there were local people there who kept up with what we did. And I don't remember what the other questions were. But
No, just explaining it. Thank you. Perfect. Okay. How about someone who took only a couple steps forward, maybe like 3 or 4? Anyone like that? Could just describe your experience. 4? Who did 4? Who took 4 steps forward? 3, 5? Who took 5? Okay. You want to share about that a little bit? Thanks. Just about what you did and kind of how it struck you.
Well, everyone's probably familiar with it, the Ronald McDonald House, it's near IPR in Michigan. Yeah. Basically, what they did, it's like a home away from home. So a lot of families that have children of Riley will, the children are going to stay there for like months at a time, so they have serious conditions. So that's going to cost a lot of money for parents to stay in a hotel. So what Ronald McDonald House does is give them like a minimal fee, and they don't have to pay the fee. They don't have money to do. They let them stay there and basically just be with the kids during that time. So.
And what areas do you think they didn't meet all those priorities? You remember?
Probably the supervision, maybe, because I really wasn't supervised at all. I kind of just did whatever I wanted, but I mean, that's the thing, they did like a screen check, so they knew I was like a normal person.
Not a mouse.
Yeah, crazy. But, so I guess that was the main one, and then I don't remember the other
Okay, no, that's great. Thank you. Thanks so much. I'm going to ask now just 2 more questions, and then you're going back to your seats. Can anyone share with me, when I first said take a step forward, right? You said this is, pretty much everyone took a step forward and said this is a good experience. It was a well-done experience. Did any of you take a step forward and then later on find, oh, I'm only taking like 5 steps or 4 steps forward? Did anyone find that it wasn't maybe as great of an experience as you previously thought? Did anyone find that? You did? Do you mind sharing about it? Okay, thanks. Any hands? You're just getting the microphone.
I did some service work in Appalachia, and so the group I went with, it was my undergrad, and they spent 4 or 5 weeks of leading students with them, assimilating to the culture, so we know what to do. But what I ended up doing is we went to this family, and everyone there was really poor. The unemployment rate is like 50%, and so if you had one person in your house working, you were a really well-off family. And so we were helped turning an attic into a nursery. And so the actual foundation, like in Appalachia I was working with, they had after-school programs and all this stuff, and I learned a lot and about all of that, but I just drywalled. So I didn't know how to drywall. There wasn't a lot of supervision, and so it wasn't sustainable, it wasn't infrastructure, not a lot of supervision.
Were you surprised by thinking through those priorities, thinking?
Well, yeah, because when I look back on it, I have really good memories, but if you're going to break it down like that, then...
Right, I think that's a really important point, is that a lot of us have great memories from our experiences, right? We all go on these trips, we have a blast, we get to know people, we in the end, we have a good product usually, like a house or something we've done, painted a wall. But in the end, what is your lasting impact? And those are the questions I hope you'll start asking yourself. What are those priorities for a good service experience? Maybe you set your own, maybe you do your own research. You don't have to use the 7 from this particular article I read. But starting to think about what are the good priorities that any organization that's providing medical care in short term or long term needs to think about. Okay? Anyone else want to share about this activity? Kind of how something might have changed their expectations or surprised them? If not, I want to Thanks for participating. I'm going to have you go back to your seats and then I have just a couple more follow-up questions. Thanks so much. Thanks to the people in the corners. Thank you. Okay. Okay. Yeah. Okay, I know that you guys have class of one and there might even be a class in here, so I'm going to finish up in the next like 3 or 4 minutes. Is that good? Okay, great. Thanks for participating. I hope it just got you thinking about some of the ways you want to evaluate your own service experiences. For those of you that are still able to stay for the next kind of this final wrap up, here's what I'd like you to do. I'd like you to think back to the original question I asked you. What are your motivations for doing this service? And I'd like you to just think to yourself, are these the right motivations? Are these the right motivations? Just think to yourself, okay? And then I'm going to leave you with a quote here, because I think I need to really know. Okay, okay, no problem. Beyond are these the right motivations, I want you to continue thinking about it. Are you going to do this work? And if you continue to do short-term medical mission work, how will you do it differently? Hopefully after today you'll come away with some thoughts or some opinions on how you might do this differently. Okay? I'm going to leave you on a quote. Everyone's favorite health interventionist, Paul Farmer. I'm going to leave you with a quote that he recently said. He was at the University of Toronto, and he was talking about compassion. And I think as doctors, you're getting really, or as aspiring doctors, you're getting really into the weeds right now with medical knowledge and memorization, things like that. So I want to bring it back to compassion, not to be too fluffy or anything, but to make you really think back to who is this about and how can we do this well. Okay. This is Paul Farmer's quote. I believe anybody can be pushed structurally into thinking compassionately and setting up systems so that people have a chance to be merciful, just, kind, compassionate, loving. All that is possible. And what does that mean? Well, if you set up a system where you have 100 people standing in line in the hot sun, and 1 doctor and 1 nurse, that is set up to just exclude any kind of compassion. That's the way to structurally determine that people be hardened. So, I wanted to just bring that quote, not to end on a down note, but to think about it. It's always coming back to, are we being compassionate? Was the organization you volunteered with compassionate towards patients, towards people? Is the organization you will in the future volunteer compassionate? And I hope that you keep that in the back of your minds as you choose wisely and go in with eyes open. Okay? Thanks so much for your time today.